Hello everyone. Today's interesting topic is medical terms used in nervous system. So what is these terms and terminologies? These are nothing but special words or expressions used in relationship to a particular subject or an activity. So they are nothing but a word which has got a meaning for itself. So there are various medical terminologies actually which are derived from Greek and Latin terms, which means different in English, and we try to learn a different language in some other language, that is Greek and Latin language in English. So if we understand the meanings of these words literally in English, it's going to help us a lot to remember these words throughout life. That is the purpose of making this video, so that we understand concepts. Welcome to Logic Medico, where understanding the concepts in medicine. If you're new to our channel, kindly consider subscribing and pressing the bell button for the latest notification of the videos. Terminologies in nervous system. This is today's topic. So to understand the terms, we should know something called as prefix, something called as suffix. So what is prefix? Prefix is something which comes before the word, before the actual word. Some words will going to come. So whenever we are writing prefix, we'll write like this: a hyphen. A for absence. That is a meaning in medical field. So aglossia means glossia. Glossia is a suffix for tongue. Aglossia means absence of tongue. Anasia. Naso refers to nose. Anasia means absence of nose. Anophthalmia. An means absence. Ophthalmo refers to eye. Anophthalmia means absence of eye. So why an instead of a? That is because it is English. A, E, I, O, U. Our English teacher has told that vowels don't like one another. So instead of a, we have just put one extra an. So what is this? Dis. Dis means difficulty. Okay. So dysphagia. Phagia refers to swallowing. Dis means difficulty. Difficulty in swallowing. So dysphagia. Phasia refers to speech. Dysphagia means difficulty in speech. So phagia means P-H-A-G-I-A. Phagia means swallowing. Phasia, P-H-A-S-I-A. Phasia means speech. Okay. So those are the suffix. Suffix are the words which come at the end of the word. So we usually put like this, one hyphen, and then write that word. So here is a word called blast. So what is blast? So blast is an immature cell. Example for this: osteoblast. Osteo is a prefix. Osteo refers to bone. Blast means an immature cell. So immature bone forming cell is called as osteoblast. Like that. Chondroblast. Chondro refers to cartilage. Chondro is a prefix. Blast is a suffix. Immature cell. Chondroblast. An immature cartilage forming cell is called as chondroblast. Like that we can go on. Neuroblast, because this is with respect to neurology. Neuroblast is an immature neuronal cell. Okay, that is the meaning of neuroblast. Okay, next, site. Site is a suffix. Site means it's a mature cell. For example, osteocyte, a mature bone forming cell is called osteocyte. Chondrocyte, a mature cartilage forming cell is called as chondrocyte. Like that, neurocyte is a mature cell of the brain is called as neurocyte. We just call it as neurons. So neurons are the structural and functional unit of nervous system. Coming to the further usage of these terms with example, just now I was telling you, neuro refers to nervous system. Blast, the immature cell of the nervous system or the immature cell of the brain is called as neuroblast. Where the mature cell will be called as neurocyte or just called as neurons. So subsequently we can use these terms a, dis, mono with respect to various context. So I'll just tell you, mono means single, a means absence, dis means difficulty. Okay. Aphasia means absence of speech. Dysphasia means difficulty in speech. It's not the complete absence, it's difficulty. Monophasia means they're able to tell a single sentence or a single word. So that is the meaning of mono. Mono means single. So that is the usage of these words. That's prefix and suffix. Like that we'll come across various other words with respect to various contexts. So the first context is paralysis. So this paralysis can be a complete paralysis or it can be partial paralysis. When it is a partial paralysis, we use the word weakness, that is English. But in Greek and Latin, there are two words, plegia, paresis. These two are, see there is a hyphen here. So these two are suffix. Very good. So these two are suffix. So plegia means complete paralysis of a group of muscles. Paresis means it's not complete paralysis. There is a weakness of the group of muscles. Means power of the muscle is still there, but not to the fullest extent. So we'll combine these words. Hemiplegia, half of the body is completely paralyzed, is called as hemiplegia. Hemiparesis, half of the body there is a weakness, that is called hemiparesis. Like that will go on. Mono means one limb, okay, either a upper limb or a lower limb. Mono means one limb. Monoplegia, paralysis, complete paralysis of the complete loss of action of the group of muscles in one limb is called monoplegia. Whereas a partial paralysis, that is nothing but weakness of one upper limb is called as, or one lower limb is called as monoparesis. So you got this. Monoplegia means it's a paralysis of one of the limb. Monoplegia is paralysis. Monoparesis means weakness of one of the limb, either the upper limb or lower limb, LIMB, limb. Now, paraplegia, when there is a paralysis of both the lower limbs, below the pelvis, both the lower limb and the pelvic area is not functional. The person is ridden to a wheelchair. Okay, that is called as paraplegia. Whereas paraparesis refers to weakness of the lower limbs, both the lower limbs and the pelvic area. Quadro means quadro, it can also be called tetra. Quadri means four. When the four limbs are paralyzed, it's called as quadriplegia. When there is weakness of the four limbs, it's called quadriparesis. So this is the application of the words with respect to paralysis or the loss of action of a group of muscles. Coming to the context of seizure. So what is seizure? Abnormal blast of neuronal activity results in excessive contraction of a group of muscle or all the muscles of the body. So when all the muscles of the body are contracting, then it's called as fits or seizures. So these fits or seizures, what is the meaning of this? In medical terminology, we use the word lepsy. Lepsy means seizure or fits. So leptic, this is just an adjective of lepsy. We'll see what is this. Epilepsy, that's the other name of seizures or fits, meaning above or around. The person is moving across his body above or around, that is called epilepsy. Epileptic means pertaining to epilepsy. Anything pertaining to epilepsy, we call it as epileptic. For example, a patient is epileptic. Narco means stupor, meaning is not oriented to time, place and person. Narcolepsy means stuporous patient. Narcoleptic means this patient is narcoleptic, so it's pertaining to that patient. Narcoleptic. Catalepsy, cata means fixed posture, means the person is lying down in the bed in a fixed posture, so that is probably called as catalepsy. Cataleptic means referring to that person, it's pertaining to that person. That is with respect to seizures. Now moving on to the case of meninges. So what is exactly meninges? Meningo, what are these things? Actually meninges, there are three meninges around the brain: dura mater, arachnoid matter and pia mater. They form the coverings or the membrane which support the brain and protect the brain. In fact, the word matter, M-A-T-E-R, matter refers to mother. So dura mater is a tough mother. Arachnoid matter is like spider web like mother, is delicate as well as tough. Whereas pia mater is a thin, delicate mother. So dura mater, arachnoid matter, pia mater, the toughest mother, 50-50 mother, tough and delicate, that is arachnoid matter, and pia mater, thin and delicate mother. So if these are the mother, who is the baby? The brain is the baby for this. So meningo refers to membranes which cover the brain. So meningitis, itis means inflammation, meningitis, inflammation of the meninges. Meningomyelitis, inflammation of meninges and the spinal cord is called meningomyelitis. Myelo refers to spinal cord because spinal cord has got rich amount of myelin sheaths. Meningeal is just an adjective. It means it's pertaining to or referring to meninges. Meningocele, hernia, abnormal protrusion of the meninges either from the skull or from the vertebral column outside. It's bulging outside. Now that's called hernia. It's called meningocele. Meningocele. Meningoma. Oma refers to tumor. A tumor of the meninges, a dura, arachnoid or pyometer, is called as meningoma. So that is about the meninges or the coverings or the membranes of the brain and spinal cord. Now come on to the next context, spinal cord. Already told you, myelo refers to spinal cord. So myelo, any word contains myelo means it's referring to spinal cord. Myelitis meaning inflammation of spinal cord is called myelitis. Myelopathy, pathy means disease, okay, pathy means disease. So the disease of the spinal cord is called as myelopathy. Myelogram, we can inject a dye and see the central canal of spinal cord and the subarachnoid space around the spinal cord. So that recording is called as myelogram. Myelogram, recording of the spinal cord is called as myelomeningocele, the herniation of the spinal cord and the meninges outside the spina bifida, that is a diverticulum present in the spine or the vertebral column, is called meningomyelocele or myelomeningocele. Myeloma refers to tumor of the spinal cord. So this is the interesting aspect of spinal cord. Coming to the next context, terms used in cerebellum. So what is a cerebellum or cerebello? It refers to little brain. Cerebellum means little brain, which is present on the dorsal aspect of the brain stem. Brain stem includes three parts from above downwards: midbrain, pons, medulla oblongata. Behind that we have a tiny brain or a little brain called as cerebellum. That's the meaning of cerebellum. Cerebrum is the big brain, cerebellum is the little brain. What is cerebellitis? Inflammation of the cerebellum is called cerebellitis. What is cerebellar? Something pertaining to cerebellum is called cerebellar. Now coming to the context of terms used in cerebrum. Cerebrum or cerebro refers to the brain or the large brain. More often than not we use this word called as encephalo, meaning within the skull. En means within, cephalo means head or the skull. So encephalo means within the skull. What do you have? Brain. Okay. So we can't tell brainitis, we can't tell cerebrumitis, it sounds awkward. So we'll tell encephalitis. Encephalitis means inflammation of something within your skull. So what is it, something within your skull? Obviously it's the brain. So we use the term encephalitis. Next, encephalopathy. There is a disease of brain. So to refer that we call like this, encephalopathy. Pathy means disease. Cephalo means head. En means within. So within the head we have a disease, that is brain disease. So we use the term in medical field, encephalopathy. In continuation with cerebrum. Cerebrum means a large brain. Cerebrate means we use something to mind or think. So what do you use to mind or think? Obviously it's the brain or the largest brain, which is above the brain stem, that is cerebrum. Cerebral is pertaining to cerebrum. Cerebrospinal meaning brain and spinal cord. Spinal means spinal cord. So for example, cerebrospinal fluid, a fluid which is encircling our brain and spinal cord. Cerebrospinal fluid or CSF. Cerebrovascular. Cerebro means brain, vascular means blood vessel. Cerebrovascular accident meaning damage to the blood vessel resulting in ischemia and death of the neurons in the cerebrum. That's called cerebrovascular accident. Come to the lobes present in the brain. There are various lobes: frontal lobe, parietal lobe, temporal lobe and occipital lobe. So you know frontal lobe is in the front portion of your head, occipital lobe is there in the back portion of your head, parietal lobe is in the uppermost portion of your head, and temporal lobe is in the side of your head. Head here refers to the brain. So in the brain is frontal lobe. We have two cerebral hemispheres, the right hemisphere, left hemisphere. 99% of population are right-handed, so left cerebral hemisphere is dominant. But two cerebral hemispheres are there. Each hemisphere contains 4 lobes: frontal, occipital, parietal, temporal. But there is a meaning for this. If you know, fronto or frontal lobe means, what is the first 5 alphabets here? So front. So what is the front portion of the head called as? Forehead. Okay. How to remember this forehead also? This is the head. So come in front of the head. Four means in front. It's not F-O-U-R. It is F-O-R-E. Forehead means front portion of the head. So that is frontal lobe. It's front portion of the brain. Parietal means wall. So our skull has got a thick area in the lower portion. It's called the base of the skull. And the upper portion, which is called the skull cap, it's a tiny wall. So parietal refers to the any structure present in the wall. So obviously near the skull cap, the parietal lobe is present. That is the uppermost portion. Temporal. So sorry for that. Occipital refers to the back of the head. Occipital refers to the back of the head. Temporal means referring to the temple or the side of the skull. So the side of the skull is behind the orbit. So any temple, if you go inside of the orbit, they will do something. Any temple, any religion you go, in the temple area, that is the side of the skull, behind the orbit, just above your auricle, that area, they will do something in that area. So that is called as temporal lobe because of that reason. Occipital, I already told you, occipital refers to the back of the head. So terms used in case of seizures, I already told you this, I think. Seizures of fits, because it is important, it's called lepsy or leptic. Epi means above or around. Epileptic means coming from the uppermost portion, that is the brain. Epileptic means pertaining to the brain or pertaining to the epilepsy. Narco means stupor or comatose. Okay, narcolepsy. Narcoleptic means pertaining to the narcolepsy. Catalepsy means fixed posture of the patient in the bed. It's called catalepsy. Like and share this video with your family and friends. Don't forget to press the thumbs up button showing that you like this video. Thank you for learning from Logic Medico. Subscribe to our channel and press the bell button to get the latest notification of the video. Thank you once again for watching and learning from Logic Medico.